Good morning. Welcome to our live Monday morning show. I'm Jessica Null. Money and Medicare. That's today's tutorial with money expert Bryan, offering a laser focus on the ABCs of Medicare. JB, how do we keep this from becoming alphabet soup? Because there's a whole lot to know.
And the alphabets really don't make any sense till about C and D, okay. I think, because C is for, I think of that as company insurance, and D is for drug insurance. But A and B are the core of Medicare. So that when you reach retirement age, actually everyone has qualified as long as they've worked for at least 10 years and contributed to Social Security for at least 10 years, then they do qualify for Part A. And I don't like to call it free because you really earned it. Then you start benefiting from your contributions by getting the complimentary Medicare Part A. So there's nothing is taken from your Social Security check for Part A, but Part A is to cover hospital care. So that doesn't cover your doctor visit.
Right.
So B is maybe what you need to bring to the doctor. Think about it that way. I don't know.
I am all ears because I don't know. I really, it's not a subject that I know about yet.
And for all of us, especially being an investment advisor, it becomes a big part of your retirement. So I did have to make sure that I developed a better understanding of it, because it is important when you start thinking about how much you need to save in order to be able to pay for Part B. It's going to be taken from your check. So your Social Security check is not going to be actually as large as what you think it is. So even when Social Security hasn't gone up, the cost of Part B has been increasing for some people. So
do you pick A or B?
No, you get A.
Okay, you get A.
Then you choose B, hopefully, because it is better for you, because there's no pre-existing considerations if you take advantage of B at the beginning when you first qualify for it. So then you get your A and your B is taken out from your Social Security check. But the C plan comes in, it's from insurance companies who bring in A and B and some other things like dental, and eye coverage can be included. And for many people, it's called Medicare Advantage is the plan C, and they include gym memberships. So a lot of seniors like having the gym membership, so they do the Medicare Advantage plans, which is the Part C, which kind of moves the A and B thought out of the way, but it's really in that C plan, it includes A and B, so you are still taking out money for your B premium, and then you'll have what you're paying for having the additional C coverages. And a lot of Advantage plans include the D, which is drug coverage. You're getting a head start here, young lady.
I sure
But
am.
it is very important that you start thinking about these things prior to retirement, because the D can become expensive. So you actually can go into Medicare.gov, put in the drugs that you're taking. Now, this is incentive for all of us to stay healthy, because if you could get to 65 and older and not have a lot of drugs that you're taking, the D plan could be a lot less expensive, because when you go into the Medicare.gov, you put in the drugs that you're taking, they'll show you what D plans, what insurance companies will cover those drugs. So of course it will be less expensive if you only need minimal things.
That's right.
So, and then you have some additional things like Medigap coverage that can kind of supplement and cover your co-pays and deductibles that you may have. You can also have what's called Medigap.
JB, we have about a minute left. You talked about budgeting for this and starting to plan.
Very important.
When, it's great to understand it early and become familiar and maybe have the goal, fewer prescription meds if you need to. How do you budget for this? Because it's going to change so much.
Yeah, and a lot of our financial planning softwares now actually include healthcare expenses estimated based on what we project will be your out-of-pocket expenses for Medicare coverage, because it is real. So what you have to do in order to budget for it is to make sure that you are saving as much as you can and investing and participating in these retirement plans that are pre-taxed at work, and creating your own, getting involved in your own retirement plan. If there is nothing in work, you cannot afford to wait, because Social Security is not going to allow you to maintain your current lifestyle for most people. So you have to have your investments that are going to supplement and take care of the D coverages and the gap coverages, so that you can really enjoy your retirement years.
Having it is good, having it is important. Saving for it's not fun. We're out of time, but do you find that most people think it's very eye-opening when you sit down and say you need to save this much or be prepared to have this much?
It's amazingly eye-opening when you find that a lot of retirees are spending over $250,000 on uncovered health care insurance needs. So we definitely, more than ever, need to make sure that a big part of your retirement plan includes healthcare coverage or get to walk and get to walk and stay healthy.
A little stroll, that's
right. Stay healthy.
You've given us a lot, and that was very helpful. So I can only imagine if I had more time to spend with you and understanding that. JB, we appreciate your insight. You offer money seminars every Wednesday at noon and Saturday mornings at 10 at the office in Glen Allen. Those seminars are free, but pre-registration is required. We'll have a link on our site, WTVR.com/